Greetings and welcome once again to another live and exciting session on the Professor Kareem Ainsley Encounter. Today we're just going to be looking at some blood bank aspects of the ASCP exam for international, or the ASCP examination. So this exam is the examination that medical technologists, clinical laboratory scientists needs to take in order to prove their competencies after they would have been successful in completing the theory and practical at a educational learning facility. And that there is the section in which we have our cytology and histology being displayed. So it seemed as though we were not getting the audio. Audio system check. Beautiful. The audio is transmitting. All right, so let us start from the top. Now that we're back online, thank you for your patience. Thank you for your time. Right. Greetings, ladies and gentlemen. Thank you for joining us for this another live and exciting session on the Professor Kareem Ainsley Encounter. Let us get into the meat of the matter of the meat that you came here to devour. So today, this is just going to be our template session in which we give you some guidance as to the content that we want to be covering in this sitting, this experience together. So the aim of our sitting, the aim of our study session is to go over content that are prudent for us to know and have competency or mastery in, as we anticipate the preparation of the ASCP, the American Society of Clinical Pathology examination. And this is the examination that all medical laboratory scientists are required to take in order to practice in the United States, especially if they are international. There are exceptions, yes, that you can do alternative examinations like the AMT examination and other subderivatives of examination. But this exam is the examination that we're going to be focusing on, the American Society of Clinical Pathology, the ASCP. The This exam has been around for quite some time, and as you may have been privy, it is comprised of 100 questions given within a 2 hour time period, well, 2 hours and 30 minutes time period. And this is a computer aided test which gives you pass or fail right at the end of the exam. So the exam is marked at on the spot. So you don't have to worry if I pass or if I fail. And if you are successful, then it will indicate pass, and then your grade will be generated through the portal. And if you need to fulfill other competencies, then those grades will be generated at a later time, and it would indicate to you the section on which your competencies were not adequate. Now, the areas of focus for this examination include, but not limited to, the main core areas: blood banking, urinalysis, and other body fluids. Then we have chemistry, hematology, immunology, microbiology, and laboratory operations. So those are the focal areas of this examination. And these areas have subderivatives. So if you're interested in these subderivatives, then it would be prudent for you to, after focusing on the main area, look at the exact charting as to what is required in the respective areas. So what we have from the ASCP Board of Certification website is that it says to us that the area of focus, especially being that we're going to be starting with the blood banking. For blood banking, there are different sections that we will have to focus on primarily. And these sections include the blood product section, in which we're going to be determined the qualification, collection method, adverse reaction, special donation, autologous situation, processing, including testing, labeling. Then we're going to have to know about the storage, anticoagulants, the additive, the time, the temperature, the transportation, the properties of storage, the product expiration. So all these little things which may seem insignificant initially, they will become of great significance. Then we're going to have to examine the blood components for the red cell, the cryoprecipitate, the platelets, the plasma, the granulocyte leukoreduced products, the frozen products, the deglycerolized red blood cell apheresis products, fractionation procedures, whole blood, wash blood, red blood cell, irradiated red blood cells. So all of these areas are sub areas which are critical for us to understand, so that we can have a grasp and appreciation for all that is taking place in the field of blood banking. And usually when we have these kind of situation, we also have moments in which we have patients who have different antibody complication when we're doing the compatibility testing. So we're going to have to understand and dissect antigen antibody complex formation, understand the principle, the testing, the complements. We are going to also have to know and appreciate the reagents that are used, why they're used, when should we use them, the methodology of utilizing them, the ratio as is needed and as is applicable. So all of these are critical for us to appreciate, and not to mention the different blood groups that exist. We know we have the ABO blood group, which many persons know, but those are not the only blood group. We have the Lewis, the RH, the MNS, the K, the Kel, the Duffy, the Lutheran, antigen of high prevalence, antigen of low prevalence, HLA, platelet specificity. We have to go through all of these areas, and it's going to be a good journey for us to share in this experience and this excitement, so that you can have an appreciation as to what each section of the examination is about. So when it comes on to the blood bank immunology, we're going to be looking at the immune responses. So that the primary reaction, the secondary response, B cell, T cell, macrophages, and how genetics plays an important part in the whole dynamics of blood products and blood transfusion. So immunoglobulin subclasses, structure, and biological and physical properties, those things will also be covered. And most times when we are given blood and blood products, it's basically because the person has blood loss taking place, they have some form of anemia, or there is a therapeutic reason. And in some cases, some situation, we don't only give blood, but we actually take blood from patients, so that they can have ease in compensating when they are over producers. All right, so those things have to be taken into consideration as well. So this journey is going to be an exciting and a phenomenal one, especially when we examine transfusion practices, indicating when a transfusion is necessary, the component therapy that are required for different areas of transfusion as is deemed fitting. Then we're going to have to look at the adverse complications that exist when transfusion is taken place. So yes, we have quite a bit to cover, but it is a hope that you will enjoy the journey with us as we are about to embark on our study session. And I want you to be mindful that the reason we're starting at the blood bank area is because this area is the easiest area to grasp, in that it may seem technical, but once this area is grasped, it branches out to the different sub areas, which we have indicated here, which are the chemistry, body fluid, hematology, immunohematology, laboratory operation, and then microbiology is in a class by itself. All right, so the blood bank section links us all to the different areas. We're going to leave microbiology at the last for us to cover that area because of how the content is structured. So that there is a mouthful. So for the month of May and June 2024, it is the hope that we can focus primarily on blood banking. And by the grace of our Father, we should be able to complete this section by the latest July. So May, June, and July, 3 months, and we should be complete with the immunohematology section of the preparation for the exam. I want you to know that the information that will be given in this section is for you to have a grasp at how to approach question. It is not designed for you to it is not designed in a similar manner or the exact manner as how you learn it in the classroom, because we are not preparing you for classroom examination. We are preparing you for critical thinking and for the ASCP examination, because it is our intention that you will be successful in the examination. So, if you're interested in journeying with us, I invite you to turn your notifications on, subscribe to the channel, so that every moment when we go live, you will be there to receive the information that we have in store for you. Want to see you in the next sit-in. And please do enjoy. And don't worry, this course will be worth it at the end of it all. So before I go, let me just pull up the textbook that I tend to refer to when doing this study. So the main textbook that is used is the Modern Blood Banking textbook. So I'm trying to pull that up right at this moment so that you can have an appreciation for this book. All right, so now that we have it, this is the book that we will be using in our discourse. And it is written by Denise M. Harmenin. And it's the 6th edition that we will be utilizing. So yes, here is the information. And I think that if you have this book available, then you are basically where you need to be in your preparation. I have used this book prior in order to be successful in my examination for the blood bank component, and I must say that this book has all the information that you would ever need to perform adequately in passing the ASCP examination. So if you have this book alone, you are in a good position. So I'm going to guide you through the whole process utilizing this book exclusively, while using other resources or making reference to other resources so that you can have a better appreciation of what is taking place. Now, I'm not going to hold you up any longer, but I hope to see you in our next live session when the study session will actually begins officially. Signing out is yours truly, Professor Kareem Ainsley. Until we meet again, your eyes on the mark as you study to show yourself approved. Be blessed.